Genotype AS and genotype AS cannot and should not get married. Hello beautiful people, how are you all doing today? Welcome back to my YouTube channel. My name is Dr. Adora. Thank you so much for being here. For those that just seeing my face for the first time, thank you so much. Please subscribe and like and click the notification bell below for information on when we post new videos. For my returning subscribers, you guys are the best. Thank you so much for subscribing, and we'll get right down to our topic for today. Sickle cell disease is a very sensitive topic, but we'll try our best to be very subtle about it and explain everything clearly for our great understanding. Sickle cell disease is an inherited blood cell disorder that affects the shape of our red blood cells. Now, a normal shape of red blood cells is discoid in shape that is somewhat circular. However, for those who have sickle cell disease, the shape of their red blood cell is crescent-like or moon-shaped. Now, what happens is that they have a problem affecting the oxygen-carrying component of the blood, which is known as hemoglobin. Now, the burden of sickle cell disease is a lot in the world, and our country, Nigeria, bears a lot of the burden. About 150,000 infants die from sickle cell disease. That's a lot, and I think it boils down to genotype. A lot of people do not know their genotype. We are living in a civilized climate. It's important that we should know our genotype. Adults should know their genotype. Parents should know the genotype of their children. It's appalling that we don't know our genotypes. It's something that should be part of your history, like something that you should know. And this ignorance, this problem has caused a huge defect in our lives and in the health system today. And sickle cell disease affects a lot of children, and it causes them a lot of pain. And this makes it important that we should try as much as possible not to have children that have sickle cell disease. There are types of genotype. We have the genotype AA, genotype AS, and genotype SC, also genotype SS. Now, when it boils down to compatibility, when it comes to choosing a spouse, genotype AA, genotype AS can get married, and then they will not have the problem of having a child with sickle cell disease. Genotype AS and genotype AS cannot and should not get married. That's why it's important that we check our genotypes and make sure that you know what your genotype is, to avoid stories and giving birth to children that have sickle cell disease. One of the problems that these children have to go through is pain. And because how this comes about is that because the blood is sickled and like the shape is different, so it finds it difficult to pass through blood vessels, and this causes some form of inflammatory changes, causing pain in the affected areas. So you have, most times they come with bone pain, go through pain on a daily basis. Imagine you have to take drugs every day. Imagine that you can't sleep because of pain. So have different forms of crisis, and complications arise, such as anemia, infections, seizures, stroke, and quite a lot of problems that arise from there. So there's no cure particularly for sickle cell disease. However, we try to improve the quality of life and try to make them as comfortable as possible to live or lead a normal life. We try to reduce the pain by giving them a lot of painkillers to help curb the pain that they're feeling. So So despite counseling and all the information around, some people allow this to fall on deaf ears, and they go ahead to marry partners who have a genotype that is similar to theirs, like AS and AS, and they give birth to children who have the sickle cell disease. Let's all just try to know our genotypes. And okay, if you have any question, please put it in the comment section, and I'll answer them promptly. And I'll see you guys. Bye.